Hi guys, Ryan Marshall here, Australian podiatrist with East Coast Podiatry in Singapore. Today we're going to be speaking about another sports-related injury and one that is commonly treated here in clinic, iliotibial band syndrome or ITBS. ITBS is an overuse injury that causes pain on the outer or lateral part of the knee, and is the most common cause of lateral knee pain within cyclists and runners. It not only affects the skilled sportsman, but also the amateur athlete. Now, first of all, what is the iliotibial band? The IT band is a band of fibrous connective tissue that runs down the thigh bone and over the knee joint. It has an important role in stabilizing the knee as it moves through flexion as well as extension. Now, it's important to mention that the ITB runs over a bony prominence just above the knee joint. Activities that require excessive flexion as well as extension can cause friction over that bony prominence, which then causes the pain, as we know to be ITBS. Well, there are multiple factors that go into the development of the condition, but one of those can be poor training habits, as well as muscle imbalance and muscle weakness. Some patients are at an increased risk as a result of their anatomy. Now, what that means, some patients may have a leg length discrepancy, which means one leg is longer than the other. They also have changes to their pelvic tilt, as well as a change in the knee position. All of these factors can create muscle imbalance and more tension throughout the region of the outer knee, which then brings about the pain. Now, what are the symptoms of ITBS? Patients will first acknowledge a stinging or a pricking sensation in the outer part of the knee. This is often ignored and then symptoms progress. Symptoms will progress to pain occurring when the foot comes into contact with the ground, and then it can also radiate up the thigh. Now, what treatment is required for ITBS? In the acute stages, patients are advised to ice the area as well as modify their activity, and also, in some cases, non-steroidal anti-inflammatories are required. Now, when attending to your podiatrist, it's very important that the biomechanical factors are assessed and treated. Now, this may mean strengthening and stretching to correct the muscle imbalance, as well as the use of a customized foot orthotic to correct the leg length difference. Now, if symptoms are progressing, therapy may be required to heal the area as well as reduce the pain and the inflammation. The therapy that we perform at East Coast Podiatry is Radial and Shockwave therapy, and today we're going to demonstrate on a patient that's currently experiencing ITBS pain on the outer knee, and we're going to perform the Radial and Shockwave therapy. We firstly need to apply contact gel from the knee joint up the thigh. We will then be working in the gel, and we'll start at the distal portion and move throughout the thigh. As we move through, the pain should be tolerable for the patient. That's okay for you? Once we have performed the correct amount of shocks for the radial shockwave, we will then move through to the focal shockwave and apply that in the area of injury. Once we have done so, we then apply the focal shockwave directly in the area of injury, and then we get started once again. That's okay for you there? So we just move throughout the area of discomfort, and we ensure that the patient can tolerate the discomfort the whole time we're performing the focal shockwave. Once we have performed the correct amount of shocks for the focal shockwave, we then will be clearing off the gel and applying a taping to help to stabilize the knee and reduce the friction throughout the iliotibial band. If you or someone you know has been experiencing outer knee pain or any knee pain in general, it is advisable to see a podiatrist to have the injury assessed and attain an accurate diagnosis. Once there is an accurate diagnosis, the podiatrist can advise on the most appropriate treatment plan for the patient so they are able to return to their activity pain-free. Thank you guys very much for listening, and I'm looking forward to seeing you soon. Take care.
For more information on related conditions, check out our other videos.